Hi, this is Irysa again. Thank you for watching today. Today I am going to be doing the abdominal assessment. I have Mr. Jones here back again. So first we're going to start off with inspection. We're going to be inspecting the abdomen for the shape, for any pulsations from the bowels or peristalsis. We will also assess the aorta, if you can see any pulsations from the aorta. You can see his breaths going in and out. Mr. Jones, can you just lift your head up? We can examine any abdominal muscles when he lifts his head up. You can lay back down. Next, what we're going to do is auscultation. We will auscultate all four quadrants of the abdomen. Using the diaphragm of the stethoscope, we're going to be listening to clicks, gurgles, bowel sounds, which is peristalsis. They should occur irregularly every 5 to 35 times per minute. So we're going to do that. We're going to assess all four quadrants, beginning with the right upper quadrant. And I do hear the clicks and gurgles. My patient here, I think, is hungry. Next, we're going to auscultate the aorta, which is above the umbilicus. We're going to be using the bell here. Next, we're going to be listening to the renal arteries, which are to either side. Next, we're going to be assessing the iliac arteries, we're just below. And then the femoral arteries. And we're listening for bruits, which bruits are like turbulent sounds, and we should not hear that, and I did not hear that. Next, we will be moving on to percussion. We'll be percussing all four quadrants, listening to the tone. We're listening for a tympanic tone. The abdomen is full of air, and we should hear a tympanic sound. So I'm going to start with the right upper quadrant. Moving down to the lower quadrant. And I heard a tympanic sound. Next, we're going to be doing estimation of the liver. We will be percussing to estimate the liver size. We're going to be starting on the right lower quadrant and percussing up, listening for the resonance and then dullness. When I hear dullness, I will mark the area, and this is the liver's lower border. This is at or just below the costal margin. So I'm going to do that. And I heard dullness right over here. And I don't have a pen, but I would mark it right here. Then I will percuss from an area of lung resonance, listening for dullness. When I hear the dullness, I'm going to mark that as well, and that will be the liver's upper border, which is between the 5th and 7th intercostal space. It's very important to percuss in between the ribs, because if you percuss right on the rib, you're going to hear a dull sound, obviously. Then I'm going to measure that, and that is the distance between the two marks is the liver span, and it's usually 6 to 12 centimeters. So I will start in between intercostal space, and when I hear the dullness and I measure between the two lines, that is the liver span. Next, I will be percussing the spleen on the other side. It is often difficult to percuss the spleen because the spleen borders like under the ribs and off to the side. So a normal finding is not too, really it's difficult to percuss. If you do percuss, it could mean the spleen is enlarged. So what we're going to do is around the 10th rib, in between the intercostal spaces, we're going to percuss in between the ribs to hear a dull sound. And then, okay, so I'm going to start at the 10th, which the 12th is the lowest. Then I'm going to count up to the 12th intercostal space, and then I'm going to percuss down until I hear dullness in between. And I just heard a dullness. Then I'm going to have you inhale deeply. Inhale, hold it. Then I'm going to percuss again. And I should hear a tympanic sound. You can exhale. Because the spleen is shifting up and there is no and at that point there is no splenic enlargement. Next, we're going to move to palpation. First, we're going to lightly palpate all four quadrants, noting any muscle resistance, tenderness, masses, anything abnormal going on. So that's just light palpation of all four quadrants. And then next, we will be palpating the liver and gallbladder. So what we're going to do is now it is on the right upper quadrant. We will deeply palpate for the liver. I will press down and up towards the intercostal margin. I'm going to ask him to take a deep breath in, and if there's any deep pain, no, not yet. Where was I? I'm sorry. Ask the patient to take a deep breath in. If there's any pain or tenderness, it could mean some gallbladder issues. Normally, you should not be able to palpate the gallbladder. So I'm going to do that. So in and up under the ribs, and if you can inhale, exhale. Okay, and I do not feel anything actually. Then we were going to be doing the left upper quadrant. The same thing, we're going to press deep and under the ribs. We should really not feel the spleen. Feeling the spleen could mean an abnormal finding. It means that it is enlarged. So just breathe normal. And you go up and under the ribs. Okay, I don't feel anything. Next, we are going to palpate the right lower quadrant, which is the appendix area. Rebound tenderness could mean an appendicitis. And then the left lower quadrant for the colon. Next, we will palpate for the kidneys. I'm going to put one hand under his flank area and the other right on top. And then the patient will inhale, and then at the height of inspiration, I'm going to press down. I'm going to start with the right. It's easier to feel the right. The left is more difficult to feel. If I do feel something, it should be smooth, firm, and non-tender. So I'm going to put my hand under the flank area, and I'm going to put this hand here. Inhale deeply. I'm going to press down, and I do feel something. Feel the kidney. Exhale. Okay. And just for time purposes, I will not do the left side, but you would do the same thing on the left side. And then we will palpate the umbilical ring area, deeply palpate, and we are looking for an area that it should be free of bulges, nodules, granulation. So, do not feel anything. And then next, we're going to palpate for aortic pulsations, which is in the center, midline, towards the left. And I do feel a slight pulsation, which is normal. And lastly, if you could just sit up, I'm going to percuss the costovertebral angles for kidney tenderness. Any tenderness? No. Okay, you can lay down. That's good. And that completes my abdominal assessment. Thank you for watching.